presentation over restraint and handling for birds. So the breed we chose was the Wild Acorn chicken. The digestive system that they have is the avian, and their blood pressure is usually 80 to 120 over 15 to 30. Hey, this is Jerome, the Leghorn chicken. He's here for a checkup. His owner thinks that he might have an ear infection. He's been tilting his head, and she thinks there's some crusty stuff around.
Well, it is very crusty and raw. It also looks like it might be infected, so that would make sense why he is shaking his head all the time.
Yeah, I think that I'm gonna diagnose him with an ear infection, and I think that the medicine we should use to clean this up, make him feel better, is Cyprodex.
Okay.
First, I need to tilt his head up to the infected ear, and I need to clean all of the crusty and the oils around his ear. Then, once everything is clean, make sure you dispose and you get your Cyprodex. And you want to rub it all around the ear and make sure that it gets everywhere and covers all of the surfaces. And then finally, set your chicken down, make sure you cleaned up his entire ear, and praise him. Alright, we did our examination on Jerome, and it sounds as though he had an ear infection, so then we applied some Cyprodex onto his ear, which is this medication right here, and then, yeah, if you apply that once or twice a day, every day for the next 2 weeks, I think it should be good. Okay, thank you. Hey guys, this is Jerome, the Leghorn chicken. He's here for a checkup. His owner claims that he has some substances oozing from his eyes, and he's been acting a little weird. Okay, I'll take a look. Alright, Lydia, tell me what you see about the chicken.
I think his head and eyes are very swollen, and there's like a substance coming out of his mouth.
Okay, it sounds to me as though he has like an avian conjunctivitis. So I think to fix this issue, we should prescribe him some Terramycin ophthalmic ointment. In order to give Jerome his medication, you have to start by cleaning around his eye where the substance is oozing out. And make sure you're throwing it away. And then after it's clean, you want to take your ointment, pull back his eyelids, and drop 2 drops into his eye. Once you're done, you want to let Jerome blink and then praise him for being good. This way. Alright, this is Jerome. So we figured out that he had avian conjunctivitis, and we prescribed him with Terramycin ophthalmic ointment. So if we apply it to him every once in a while, maybe once or twice a day, then he should be good and all healed up within the next few weeks. This is Sasha, the Leghorn chicken. She's here for a checkup. Her owner claims that she's lost a little bit of weight and has seemed a bit lethargic recently.
Yes, I would definitely agree with her owner. She is very underweight, and it looks as though she might have had some diarrhea recently. So there's definitely something going on. We need to get that figured out.
It sounds to me as if though she has salmonella, so I think I'm going to diagnose her with that. And I think the proper medication that she should need for this situation would be ceftriaxone. So I'm going to fix her with that. First, we're going to have to clean our injection site, which will be the breast because it has the most muscle. And once it's clean and prepped, we'll take our needle with our medicine, and we're going to inject it at a 90-degree angle, and then we'll aspirate to make sure there's no blood, and as long as there's no blood, we can inject, put our needle in the sharps container, rub the injection site, and give our chicken praise. So we have discovered that your chicken has been diagnosed with salmonella, so to fix this, we gave her some medication of ceftriaxone, so she should be all set, and if not, come back to the vet and we will fix her up. Okay,
our physical examinations to figure out how Gloria. Got you. Oh man, that office gloves always get in the way. So he's obviously been panting since he's been here. He has very pale waddle, so he's looking very lethargic. Okay, it sounds to me like Gloria has severe dehydration. And I think to fix this, we need to have sterile crystalloid solutions.
Would you assist me in restraining Gloria?
Of course. Our proper restraining technique is to make sure Gloria's wings are firmly pressed against her body to make sure she doesn't wiggle or anything while we're performing this procedure.
Then you pinch her skin on the back of her neck and insert the needle. You aspirate to check for blood, and if there isn't, you remove the needle, put it in your sharps container, rub the injection site, and give Gloria breaks. Gloria's right in here.
Hello. So your chicken Gloria, unfortunately she was severely dehydrated, but we fixed this by administering a sterile crystalloid solution. So she should be all good now.
Yep.
We will not be performing cytosyntoses in companion animals on chickens because chickens don't have bladders, so you can't really do the procedure. But if you were to do the procedure in the companion animal, you would place the animal in the correct position, locate the bladder, stabilize the bladder with one hand, inject the needle, and aspirate, inject the medication, and then release pressure with one hand, and praise the vet.
Hey guys, Jerome is back again. His owner is claiming that since he has kind of like a cold, he's been coughing, sneezing.
Okay, sounds good. We're gonna have our amazing Vestilia perform a physical exam. He has very watery eyes. He's obviously been sneezing and coughing, and yeah. Okay, so it sounds to me like he has a respiratory infection, so I think that we need to prescribe some antibiotics for his healing process.
Okay. In order to give Jerome antibiotics, we have to give him a tablet and we have to make him swallow it. So we're gonna secure him under your arm using your middle finger and your thumb. Open the beak. You'll put the antibiotic in his mouth, close it, and rub his throat to make sure that he swallows. And once he has swallowed the medication, you can release him and praise him and tell him that he did a good job.
Alright, so we took a look at Jerome today, and unfortunately he does have a respiratory infection, but we did prescribe some antibiotics, so we hope Jerome starts feeling better.
Thank you.
This is our quiz. Number 1, what area is best to administer an intramuscular injection? The breast, thigh, lower back, or neck? Number 2, if Jerome has an ear infection, what would you give him? Ophthalmic, oral, influenza, or oral? Number 3, what is the vet assistant's job in a vet clinic? Stand and watch, pet patients, clean and examine, or sing? Number 4, what should you do after any injection of medication? Give praise, clean, give patient back to owner, or kick it? What breed of chicken was Jerome? A Polish chicken, a white chicken, a Brahma chicken, or a white leghorn?